And Dr. Darien Sutton may or may not be watching that, but he does join us again now with a health and wellness question. Juliana asks, what could be the cause of my fibroids?
I have this conversation more often than many think because fibroids, although they're generally not dangerous, they can increase the risk of heavy menstrual bleeding and also pain that patients come into the emergency room for. To answer this question, there's no known exact cause to what causes fibroids, but we do know what increases one's risk. If you have an early menstrual cycle starting period, for example, starting before the age of 10, a history of obesity, a diet low in vitamin D or high in red meat, these are some of the risk factors, but also there's just simply a genetic risk. If you have a family history of it, you might have a more likelihood of getting it. And also the diagnosis is really important. Ultrasounds is where we come at. That's where we identify the fibroid, locate it, and then create a plan that's best for the patient.
Your prescription for wellness?
Given that we have frigid temperatures across the nation, I think it's an important reminder, even here in New York City, I am treating the complications of frostbite. So today's prescription for wellness around ways and terms that you should use to prevent frostbite and things you should know. Number one, watching for the signs. If you notice that you have numbness that's persistent just beyond staying outside or a waxy appearance to your skin, those are the first signs of something called frostnip. That's early frostbite, and that means that it's reversible as long as you get out of that environment. And when you get out of that environment, you want to avoid hot water. A lot of people reflexively want to put their hands, for example, under hot water. You want to make sure that that water is just warm, basically body temperature, and you want to avoid rubbing your skin as well. I know that's often a common reflex, but when you have cold injuries, when you rub, that can damage delicate blood vessels and increase your risk of harm. And then seek out medical attention when you notice, for example, that pain is out of proportion to your exam. If you're noticing that you just can't stop the pain with basic medications like Tylenol or ibuprofen, or if you notice blisters, these are reasons why you need to get evaluated. Some of these patients I need to send to burn treatment centers because it can be so severe. So it's so important to pay attention.
Can I tell you, my husband tried to shovel the driveway without a coat on.
And it's interesting because mostly the patients taken care of are men. So that speaks to that.
Wait, when was he doing that?
When it snowed.
But like, was it when it was like been freezing here?
It's cold. Like recently,
He's British.
Was this week.
He's a little.
He was like, you're working up a sweat. I was like, put your jacket on.
Wow. All right.
Well, men live longer when they have wives.
Yeah. Next week, Dr. Darien, you're going to diagnose Eva's husband, whatever's wrong with him. Be sure to hit us up on Instagram with all of your medical questions at ABCGMA3.